So whenever you talk about gum disease, one is a superficial cleaning and one is a deep cleaning. What we forget is that we remove all the tartar that we can see. But what about the tartar that you cannot see? And that tartar is actually below the level of the gum. So when there is a tooth, there is gum. Below the level of the gum, there is a lot of tartar, which we actually can see when we are magnified. At the same time, the bleeding gums. So we feel that 80% of the times what we feel is when you remove the tartar, the bleeding gums is gonna. That's not the exact solution of it. The bleeding gums is because the tissue is also gone bad. The gum tissue that is bad, that is called granulation tissue, needs to be removed with a procedure which is called as laser assisted new attachment procedure, which is called as LANAP. So what we do is we use the laser tip, we can insert it deep between your tooth and the gum. We can remove all the tartar with a laser energy, which is going to cause a lot of vibration, which is called as photo-induced photoacoustic streaming, which is called as PIPs. At the same time, when you remove that, we also at the same time disinfect the area, seal the cementum, so we can remove all the granulation tissue that is surrounding the tooth. So we can actually create an environment where you remove the tartar, you remove the bad tissue, the bleeding tissue, then there is some fresh blood in the socket, there is a fresh blood between the tooth and the tissue, and that creates a new tissue and new attachment. And the gums, what we feel, what we tell you is that it tightens the gums in your language. So it's basically newly attached tissue that is formed, and that's how you treat gum disease, what you call as periodontal disease or gingival bleeding or gingivitis. It's amazing to use a laser and treat it, disinfect the tissues, and which is probably an alternative in a lot of cases of flap surgeries. Flap surgeries, you remove it manually with the blade, but with this, it is 80% to 90% of the times we don't even inject the patient. It's amazing for the deep cleaning of the tissue as well as the tooth.